Hey, healthcare friends, do you dread doing your notes every day? Do you feel like you can never get ahead of charting? If you're shaking your head yes, keep listening. Freed AI is a medical scribe on a mission to free clinicians everywhere. Freed AI listens, transcribes, and writes medical documentation for you, written in your style and ready the moment the visit is over. All you have to do is give it to your patient. Just imagine leaving the office at the same time as your last patient. Freed is HIPAA compliant, secure, and takes less than 30 seconds to learn. Artificial intelligence cannot replace you, but it can do the administrative work that no human should be subjected to. Get back to doing what you love, helping your patients, and let Freed AI do the rest.
Hey all, welcome back to the Real Life Pharmacology Podcast. I'm your host, pharmacist Eric Christensen. Thank you so much for listening today. We're continuing on with more individual medications at this point. Going to cover Loratadine today, brand name Claritin. Before we get to that, I want to remind you, go take advantage of the top 200 study guides. Great refresher. If you're in school, great little study guide that you can have, absolutely no cost to you, simply an email. We'll get you access to that. And then we get you out new updates when we've got new podcasts and other content available as well. With that said, special announcement today. I've put out a brand new book. For the next week, at least, it will be priced at cost. I'm basically pricing it as low as Amazon will let me price it for 1 week. So go check that out. It's a nursing pharmacology crossword puzzle book. Definitely go take advantage of that. Search it on Amazon. It's a nursing pharmacology crossword puzzle book by MedEd 101. So, kind of a unique announcement here on this podcast episode. All right, let's get into the medication. Loratadine, like I said, brand name Claritin. This is an antihistamine, and it's a second-generation antihistamine. So when you hear somebody talk about second-generation antihistamines versus first-generation antihistamines, recall that first-generation antihistamines have a greater effect on the central nervous system. So, first generation antihistamines, way more anticholinergic. Dry eyes, dry mouth, sedation, confusion. These can all happen, or it's much more likely to happen with a first generation antihistamine like diphenhydramine, for example, which is also available over the counter. Loratadine, again, second-generation antihistamine being available over the counter. Mechanistically, it acts more on peripheral H1 receptor. Okay? So that's why it's got a little bit less CNS activity, a little less CNS, central nervous system adverse effects there as well. Okay? So again, H1 receptor blocker. But it is second generation, so it's going to do that less in the central nervous system. All right, so uses for this medication, as you could imagine, are somewhat similar to what a first-generation antihistamine is. Allergic rhinitis and urticaria are probably the two most common indications I see it used for. So allergic rhinitis dosing is for adults is typically going to be 10 milligrams once a day. And with that said, for the management of allergies and allergy symptoms, we're going to use these antihistamines typically for kind of mild to moderate symptoms. The exception being they may be an add-on in patients that don't have a good enough response to nasal corticosteroids. So backing up, nasal corticosteroids typically are going to be used first line for more moderate to severe cases because they have greater efficacy, or it's been proven that they generally have greater efficacy in treating allergic rhinitis symptoms and that postnasal drip. But again, in patients with moderate to severe cases, non-responding cases, you will likely see a drug like loratadine used in combination with a medication like nasofluticasone. Okay. Urticaria, I'll mention specifically. We do have a little bit higher dose, maximum dose for urticaria that we might consider, up to 10 milligrams twice a day. I have seen this used in practice. It's not incredibly common that you see that higher dose of 10 milligrams twice a day, but it is out there, and I have seen it occasionally in practice. Now, with urticaria, one thing I would really caution you on, and somebody that comes from the polypharmacy world, make sure we rule out new medications causing itching. Okay, opioids, antibiotics, these are two common classes that can cause some skin type reaction and some itching type effects. Definitely got to make sure that we look at that medication list when somebody's reporting new onset of itching or skin type issues. Okay, for urticaria, I typically see diphenhydramine and first generation antihistamines used more for this indication, but occasionally I will see some of the second generation antihistamines used in that situation. I want to mention pediatrics. Loratadine can be used in pediatric patients. One of the nice things about this medication is we do have various dosage forms. Probably the two most commonly used dosage forms I see in pediatric patients are solutions as well as chewable tablets. Dosing, kids age 2 to 6 is 5 milligrams. Kids above the age of 6, you may see 10 milligrams utilized there. I want to mention pregnancy briefly. Overall, it's got a relatively decent safety profile, and loratadine may be considered here if something is needed in pregnancy for managing allergic rhinitis and some of the non-pharmacological interventions such as allergy trigger avoidance. Those are ineffective or not effective enough there. Renal function, 10 milligrams every other day in patients with a creatinine clearance less than 30 mils per minute, so there can potentially be some accumulation there as renal function declines. Adverse drug reactions, again, being mostly peripheral effects and not a ton of central nervous system penetration. The adverse effect profile of loratadine compared to a first-generation antihistamine like diphenhydramine is much less. Okay, can potentially see some headache reported, maybe some mild sedation. Rarely I have seen dry mouth and stuff as well. Usually that's at higher dosages that you're probably going to get some of those issues, but I did just want to lay out some of the more common adverse effects there as we get to higher doses. But again, much better tolerated typically than the first generation antihistamines. Now, you may see less of a response as well, especially when we're talking about managing that itching type effect. Some of the kinetics I'll mention here briefly. Don't expect an absolute relief of symptoms within an hour. Onset of action is typically going to be at least 1 to 3 hours, so that's a good patient education point. It may take a little while to kind of see its effects. That peak effect from the medication is in 8 to 12 hours. And then typically it being dosed once a day, you're going to potentially see that duration be in the neighborhood of 24 hours for most patients there. Again, that depends upon renal function as well. That drug is going to linger a little bit more in patients with poor renal function, which is why we look at doing some of that alternative dosing where we give it every other day, for example. All right, let's take a quick break from our sponsor and we'll wrap up with drug interactions. If you're in the market for any pharmacist board certification study material like BCPS, ambulatory care, geriatrics, NAPLEX, BCMTMS, go check out meded101.com/store. We've helped thousands of pharmacists pass their board exams, and we can help you too. So again, support the sponsor, help keep this podcast free and available for all to benefit from. And you can do that meded101.com/store. All right, wrapping up with drug interactions. There aren't a ton that I really worry about with loratadine, so that's good. With that said, the additive sedative effects, again, not incredibly strong with loratadine, but if you've got a patient that's already taking, numerous sedative type medications, or they're drinking a lot of alcohol, loratadine could potentially have a slightly additive effect to that issue. So, alcohol, I mentioned, benzodiazepines, opioids, definitely medications with sedative type properties. QTC prolongation, not crazy high on my list that I worry about this. Amiodarone, antipsychotics, we could potentially have an additive type effect there. There is some breaking down of loratadine by CYP3A4. Again, that's an enzyme that breaks down many medications. How much of an extent is it broken down by CYP3A4? It's definitely not like 100% or everything or anything like that, but it is somewhat broken down by CYP3A4. So there is potential, medication like ketoconazole, for example, systemic ketoconazole, could raise concentrations of loratadine. All right, well, that's going to wrap up the podcast for today. If you found this episode beneficial, I would greatly appreciate a rating review on iTunes or whatever platform you're listening. I would greatly appreciate any purchases at meded101.com/store. Your support there goes directly to support this podcast. We've got stuff for everyone there who's looking for pharmacology education. Drug-drug interactions, clinical case studies, clinical pearls on Amazon books, drug-food interactions, again, tons of stuff, board certification content, again, all those things you can find at meded101.com/store. If you have any suggestions on upcoming episodes, feel free to reach out to me, mededucation101@gmail.com. Comments, suggestions, I greatly appreciate all the emails I've received from listeners over the years. So don't hesitate to do that. Again, mededucation101@gmail.com. With that said, thank you all so much for listening. Take care, and I hope you have a great rest of your day.